So no phones, no walk. So the rules. Yes. No phones. 30 seconds per question. At the end of each round, we'll give you 30 seconds to complete. Okay, you'll be provided by paper. I will give you a paper. Write your answers. So don't choose any of those. So remove all those papers of yours. No walking out. Okay, during the round. Okay, if you walk out during the round, you cannot rejoin the team until the round is over. Okay, each round is like 5 minutes. Okay, there'll be equal teams. We've separated you by cadres. So get to know each other. Who is strong in nursing, who is strong in EMS, who is strong in medicine. Yes. Then there'll be a tiebreaker round in case there's a tie somewhere. Okay, any questions?
Yeah.
No phones, no walking out. All right.
Round one.
Round one. Okay, one person has right. Round one starting now. The Canadian ED triage and acuity scale has 5 levels. What are the expected wait times for each of the levels? No, you write your answers. You'll mark them at the end. Okay? So that's question 1. So you write question 1, this is the answer. Question 2, this is the answer. Okay? Each question is 30 seconds. Emily. No? Is this true? Okay. Question 2. What is the appropriate ventilation rate for an adult respiratory arrest in breaths per minute? Breaths per minute. Name 5 H's and 5 T's in the cardiac arrest algorithm. Question 3. Name 5 H's and 5 T's in the cardiac arrest algorithm. You can hear your answers. Question 4. After how many shocks should you give the first dose of amiodarone in a VF pulseless VT cardiac arrest? After how many shocks should you give the first dose of amiodarone in a VF pulseless VT cardiac arrest? Question 5. What's the target end-tidal CO2 range for in millimeters of mercury following intubation in post-cardiac arrest? Okay. What is the target end-tidal CO2 range in millimeters of mercury following intubation post-cardiac arrest? In millimeters of mercury. Question 6. Name this device. Emergency case, easy. Question 7. How many times do you clear the patient before shocking using an AED? How many times do you clear the patient before shocking using an AED? Question 8. What is the name of the technique used to hold a mask during bag valve mask ventilation? What is the name of the technique used to hold a mask during bag valve mask ventilation? These are easy questions. Question 9. How many providers are recommended to ventilate a patient using a bag valve mask device? How many providers are recommended to ventilate a patient using a bag valve mask device? Question 10. Name 3 shockable rhythms. Question 10. Name 3 shockable rhythms. You have 30 seconds to wind up your answers.
Wait.
Time's up. Bring up the answer sheet. Answer sheet, answer sheet, answer. Give us the answer sheet. Answer sheet. Okay. So question 1 was the Canadian AD triage has 5 levels. What are the expected wait times for each level? Okay. Just go through them. All right. Level 1, resuscitation, 0 minutes. Level 2, emergent, 15 minutes. Level 3, urgent, 30 minutes. Level 4, less urgent, 1 hour. Level 5, no urgent, 2 hours. Total marks for the question is 5 marks. So 1 mark per level. Okay. Good. Question 2. What is the appropriate ventilation rate for an adult respiratory rest in breaths per minute? That's how many breaths per minute? 10 breaths per minute. Okay. It's 1 breath every 6 seconds. Okay. So yes. So ventilation is 1 breath every. As you can see, give 1 breath every 6 seconds. So it's 10 breaths in a minute. Okay. Good. Next question. Name 5 H's and 5 T's in the cardiac arrest algorithm. So any of the above: hypoglycemia, hypovolemia, hypoxia, hydrogen ions, hyperkalemia, hypothermia, tension pneumothorax, cardiac tamponade, toxins, thrombosis pulmonary, thrombosis coronary. This one is 5 marks. Previous question was 1 mark. This is 5 marks for this question. Question 4. After how many shocks should you give the first dose of amiodarone in a VF pulses VT cardiac arrest? We can count them. All right. So shock number 1, shock number 2, shock number 3. So after 3 shocks. Yes, and that question has 1 mark. All right. Next question. Target end-tidal CO2 range in meters of mercury for intubation post-cardiac arrest. Okay, the target is 35 to 45 millimeters of mercury. What's the name of this device? This is a Lucas device, okay? All right. So mark it out of 20. Okay, and you just register. All right, so mark it out of 20. So, round 2, question 1 for 1 mark. What's the complete name of this device? Laryngeal mask airway. Right. LMA, laryngeal mask airway.
Not laryngeal airway mask.
Does not exist. Question 2, okay? When troubleshooting an intubated patient who is not ventilating well, what do the letters DOPES in the mnemonic represent? Okay, so let's get to the algorithms. So intubated patient. Where? Yes, so DOPES. Okay, so D stands for displaced endotracheal tube or cuff. O, obstructed endotracheal tube. Patient biting down, kinking of the tube, mucus plug, but the keywords are the first ones. P for pneumothorax. E for equipment check. Okay. You follow the tubing from the ET back to the ventilator and ensure everything is connected. S stands for stacked breaths. If they wrote stomach for pediatrics, that's also accurate. Okay. So out of P, patient able to get it out of the lungs before you get to the next breath. Respiratory time is much shorter respiratory, so that's a DOPES mnemonic for troubleshooting a patient who is having problems with the ventilator. Okay? So yes, if they wrote, so it's S is stacked breath or stomach when you're dealing with pediatrics. Sorry? Yeah, so that's 5 marks. No, 4 marks.
Huh?
There are 5.
Okay. So if you get out all of them correctly, you get 4 marks.
You get 1 wrong.
Actually, if you get
1 wrong.
okay, so we'll have to do this math now.
Yes.
To be out of 21. Actually?
Make it
It
up.
also
So you get to 21. Okay,
Yeah.
so 5 marks. Okay. Alright, question 3. In anaphylaxis, what's the most optimal location to inject adrenaline? Okay, let's go up and see where the anaphylaxis algorithm is. Essentially, it's anterolateral thigh. That's the answer. Okay. So anaphylaxis. So location is inject adrenaline in the anterolateral thigh, all age groups. Yes. Anterolateral thigh, upper. Yes. Anterolateral thigh. There's no blood vessel here. Well, I'm sure you dig deep enough, you'll find one. That's the most optimal. Why? Why is it most optimal? There is improved blood supply at that area, and by the time you get an IV, the patient will be there. So anterolateral thigh is the recommended location for anaphylaxis adrenaline injection. Name of this device: laryngeal tube. The name of this device is a laryngeal tube. Okay.
What's the combi tube?
Sorry? Combi tube is different. Let me show you.
It's a combination of IET tube and this one.
So this came after, yes. Let me just show you the combi tube. So the laryngeal tube came in after the combi tube. Okay? So that's actually the latest version of the combi tube. Okay? So combi tube essentially it's a blind application device, that's a glottic device, where you just push it in. It goes straight into the esophagus. This blocks off the esophagus. This blocks off the upper airway. So you have holes here that then ventilates the patient through the trachea, and then has two tubes at the bottom, at the top there. Has pretty much gone out of fashion. No one is using them anymore. But yes, that was a combi tube. Then sorry?
Half mark.
There's no half mark. Because of tube. So all of this, no. Laryngeal tubes are available here. They're very easy to use. Essentially, you just slide it down the patient's throat. This goes into the esophagus, and that balloon blocks off the esophagus. There's a small airway opening here that goes in the trachea that blocks up the oropharynx. Okay? Ideally, we should all be stocking. They're available in the country, and it's where you have a difficult intubation, you're not good at intubation, it works very well too. Just put in a patient, and you can put them on a ventilator. There's no skill, advanced skill required here. Just slide it down the patient's, the same way as an LMA. Slide it down the patient's throat, inflate the cuffs, bag the patient, and you actually, it's like you've intubated the patient. Yes.
If you have both LMA and
Yeah.
this one,
This is better.
This is better.
This is way better.
Oh, okay.
Yeah. This is way better. LMA, the problem is sometimes the cuff, I don't know, is sitting badly.
Yeah.
There's a lot of things with the LMA and you get leakage. This one is very straightforward because that one goes straight in the esophagus. This one blocks up. There's no issue of the cuff sitting funny. Alright, in asthma, the peak expiratory flow rate of a patient is based on 3 factors. Name them. Alright, let's look at that. Okay. So that's a peak flow chart. Okay, so it's based on age. Okay. Height of the patient and the sex. Sex. There's a male and a female. Age, height, and sex. Because you don't use peak flow charts in your departments.
I don't think most know what
So in an acute asthmatic attack, when you're trying to determine how severe the severity or if the patient is getting better, you have to be measuring the peak flows, and there's a whole procedure, the protocol. But essentially, age, height, and sex. Those ones working in the ARD, you've been using peak flow charts every day. What do you check? Yes. Alright. Okay. In epistaxis, what's the first step the patient has to take before pinching the nose? I'd like to get your answers on this one. What's the first step? Ask the patient to blow the nose to remove any clots. The first step. Yes. Okay.
But the
the first step, no, the first step in any patient who comes is blow the nose to remove all clots, then you pinch. Yes. Yes, so you remove the, because the clots again also prevent you from actually holding putting the pressure. Because normally they come with a lot of clots, like whatever. So the first thing is you want to clear all the clots, then you pinch the vessel now. Because now you're not pinching the clots, you're pinching the vessel. Yes. Okay. In epistaxis, how long should the patient pinch the nose before the assessment?
15 minutes.
What the algorithm is 10 minutes. Okay. 10 minutes, you reassess. 10 minutes, you reassess. So 10 minutes before the assessment. So and you have to use a watch, not just 10 minutes of I think it's 10 minutes. So, okay, it has to be timed 10 minutes. Alright. Question 8. In an ECG, which leads represents the lateral aspect of the heart? That's very easy. I'm sure you all got that one. This one is what you're familiar with. So lateral aspect of the heart is lead 1, AVL, V5, V6. Okay. Next question. Question 9. What is the position on the chest for lead V4R? Do you even know what lead V4R is? What is lead V4R?
You place it on the right side.
Okay. And what's the position?
For the
Very
Okay. Alright, so lead V4R. Okay, essentially it's the lead V4 that was on this side, that's on this side now. So mid-clavicular line, 1, 2, 3, 4, fifth intercostal space, mid-clavicular line. That's why you're suspecting a patient has a right-sided on the right side. You have to write on the right side. If it's not on the right side, no. 0. It has to be on the right side. Yes. Okay. So before R, okay, on the right side.
Wait, you are saying something you're suspecting?
A right-sided myocardial infarction. This is where you probably have ST elevation just lead 1. And sometimes you have on the inferior leads, in fact, this is the protocol actually, I'll tell you that. You have ST elevation, isolated ST elevation lead V1, okay, and everything else the same. By patient has the symptoms, then you go V4R, where you're suspecting the right ventricular myocardial infarction. Okay. Question 10. Name 3 drugs that may be used in the pre-hospital environment for management of chest pain. Number 1, aspirin. Number 2, nitroglycerin. Number 3,
oxygen.
oxygen. Oxygen is a drug, yeah? There's no chlorphylloquin in the pre-hospital environment. So oxygen, aspirin, and nitro. Oh, yeah, and GTN, yes. Good. Sum up the marks. What are the 5 components of a heart score? In the emergency department assessment of chest pain, what are the 5 components of the heart score? Okay. So that's a heart score. Okay, so it's used to assess patients with non-ST elevation in mind. So the 5 components are history, ECG, age, risk factors, troponin. Okay? So history, you get points, you don't have to write them. That's why I didn't say write the whole thing. So history, ECG, age, risk factors, troponin. So in history, you either highly suspicious, moderately suspicious, slightly or not suspicious. ECG, there is significant ST depression. Non-specific polarization, or it's a normal ECG. Age is above 65 years, more than 45 but less than 65, or less than or equals 45 years. Risk factors, more than 3 risk factors for or history of coronary artery disease. 1 or 2 risk factors. Risk factors are diabetes, current or recent, less than 1 month, smoker, hypertension, hyperlipidemia, family history of coronary artery disease and obesity. And then troponin, more than 3 times normal limit, less than 1 or less than 3 times, and less than or equals to normal limits. Okay. So if you have a score of 0 to 3, your probability of having an adverse event is very low, 2.5%, so you can go home. If you have a score of 4 to 6, it's a bit higher, you need to be admitted to observation. If you have a high score, 7 to 10, you probably need to go to a cath lab. Yes. We told you to read the protocols. We told you. We said read the protocols.
Mulipewa mwa Kenya.
We told you the answers and where they're coming from. Alright, what's the name of this device? It's a scoop stretcher. Okay, scoop stretcher. Alright? It's a scoop stretcher. So it's not trauma scoop, it's a scoop stretcher. It's not a trauma scoop, it's a scoop stretcher. It's not a trauma scoop. It's a scoop stretcher. Yes. Alright. When pacing a patient, what are the 3 types of capture you need? You need to confirm. Alright. Let's see. Transcutaneous pacing. Alright. So you have electrical capture, you have mechanical capture, and physiological capture. Alright, so 3 of them you get the 3 marks. Okay, what's the name of this device? This is easy, it's a spider harness. Spider straps or spider harness. So yeah, both of them, both are correct. Spider straps and spider harness. Yes, that's accurate. Next one. Let's see. Next question. Alright, let me show you. Best shown on a picture. Spider harness. So it's used to strap down a patient in the pre-hospital environment. How many things? There are pre-hospital people here. What it's used for. Okay, so yeah, that's a good example. So pretty much they're transporting, that's why there are holes on the side of the stretcher. Okay, so pretty much strap down the patient to prevent them from pretty much falling off. Okay, so yeah, normally it's, as you can see, that's the holes on the spine board or the stretcher formally to secure the patient. Aha, good question. Let me, EMS, I should ask. Do you start tying the patient from the top or from the bottom? I was asked this once when I was young. Do you start strapping the patient from the bottom or from the top? From the bottom forwards. Tikati then? Back then. Do you strap the patient from up, down, down, up, or up, down? Down, up, down. Up, down. I can't explain.
We start from, we first get that viewpoint.
So you get the viewpoint
You get
first.
the viewpoint, then you put the ones that go down, then you go up, down.
Then you up, down. Now we know.
But look at the elbow where it is. So one has to come above the elbow. You look at the joints. One is going above the joint, even at the knees, above the joint, below the knee. Look at the hip also. So you're stabilizing the joints.
You learned something.
Yes. All right. Next question. Imaging of choice for TIA is MRI. Yeah. We don't need TIA. No. Imaging of choice for the brain in general is MRI. Okay, CT is for trauma and strokes when you're thrombolized. Because the only indications for CT head is trauma and subarachnoid hemorrhage, if you're thinking that's one of the things, and for a patient who you're going to thrombolize, where you're doing the CT to rule out a bleed. everyone else, imaging of choice for the brain is an MRI. Yes. So the only three indications for CT head: trauma, bleeding when you're thinking subarachnoid and then there are 4 actually. So trauma, subarachnoid, stroke when you get thrombolyzed. 4th one is if your patient can't lie in an MRI scanner for an hour. Okay, so those patients who are unstable, you can't keep them in the MRI scanner for an hour, then you do the CT. Yes. But for everyone else, MRI.
And this is such practice in
How many times do you do CT and then ask for an MRI? How many times do you do a CT then you ask for an MRI? Just not done. Just do the MRI. All right. It's actually a little TIA algorithm. Yes. Watu warudi shule. But you imagine setups. Hamna imara Kenyatta?
down for the last almost 5 years. We just bought a new one recently.
So for definition, for you to say it's a TIA, okay? A transient episode of neurological dysfunction caused by focal brain or spinal cord or retinal ischemia without acute function, okay? So emphasizes neuroimaging. You cannot say it's a TIA until you image the patient. Imaging of choice, MRI. Yes. Okay, next question. 5 life-threatening causes of chest pain. Okay, this ones are simple. Let's see. It's ACS, B, tension pneumothorax, cardiac tamponade, aortic dissection. Those are 5. And ACS, the mind. As a life
in trauma, not in cardiac.
that's wrong. No, life. VHS is not life-threatening. It's just tension pneumothorax will be now the life-threatening part. So tension pneumothorax. No. No. Tension pneumothorax. Massive is not life-threatening. Cardiac tamponade. I was checking if those things were in the algorithm, so they're still there. Life cause of chest pain.
Because they're still in teams.
What? Okay, so the things we have removed them. But yes, also the life-threatening cause of chest pain.
You can sit here.
Alright. Next question. Which of the following is not an end organ? Okay, the liver. The liver is not an end organ. Okay. Next one. Which of the following is a hypertensive emergency? Okay. Eclampsia is a hypertensive emergency. That is not a hypertensive emergency. Alright. Question 9. How do you accurately size the device below from the angle of the mouth to the angle of the jaw? Yes. Angle of the mouth, the angle of the jaw. Angle. Mid incisor, yes, is the question. That's the angle. Yes. You see angle of the mouth to the angle of the jaw. But yes. Adult dose of subcutaneous adrenaline in an acute asthmatic attack.
Sorry, for that question,
yes.
OPA. Some people also information, the ERP, I don't know.
That's for the triggers is for the NPA. NPA is on that goes until the triggers. Alright, so adrenaline dosage is here 0.3 to 0.5 milligrams subcutaneous every 20 minutes for 3 doses. Right. Okay, good. Tally your marks. Please indicate, that's the end. So please indicate how many, 1 mark, 2 marks, please indicate the marks. So that when we are verifying that we know exactly what it is.
Head, shoulder, knees and toes, eyes, ears, nose and mouth. Again, 1, 2, 3, quick. Head, shoulder, knees and toes, knees and toes, knees and toes. Head, shoulder, knees and toes, eyes, ears, nose and mouth. Okay.
Round 4, kicking off now. Question 1. What do the initials PAC stand for in the PAC rule? What do the initials PAC stand for in the PAC rule?
Iko kwa kitabu.
In the protocol. Pulmonary embolism.
Hiyo umepewa leakage.
4 marks. So what do the initials PAC stand for in the PAC rule? WOI. They don't stand for WOI. Alright, so pulmonary, so they stand for, wait, not here, here. Pulmonary embolism rule out criteria. Pulmonary embolism rule out criteria. So essentially, in patients who are low risk, if they do not meet any of these criteria, you can discharge them home without a silent CPA. So if the patient more than 49 years of age, is the pulse rate more than 99 beats per minute? Is there a pulse oximeter reading less than 95 for the patient is breathing room air? Is there a present history of hemoptysis? The patient is receiving exogenous estrogen? Does the patient have a prior diagnosis of venous thromboembolism? Has the patient had recent surgery or trauma requiring intubation or hospitalization in the previous 4 weeks? Does the patient have unilateral leg swelling or asymmetry of the calves? Okay. If any of these criteria is low, they can go home. Okay. And that is a patient with low probability of being after injury.
Because how many marks?
4 marks. 1, 1, 1, 1. Okay, so 4 marks. Yes, so I gave you 2 already. All right. What does a STAT triage? What does STAT mean in STAT triage? Simple triage and rapid treatment. Okay. So simple triage and rapid treatment. STAT triage. So that you can look at it. A jump start here. Yes. It's used, this would be very relevant. Is this good enough? Yes, I think it should be. Alright, so this is used like in the disaster that happened. Okay, prehospitally patient, anyone who's walking is minor, is triage green. Respiration, if are they breathing? If the answer is no, you open the airway, jaw thrust or head tilt, dependingly. If they're still not breathing, they're dead. If they start breathing, then they become red or immediate. If they're breathing yes, is over 30 breaths per minute, they're immediate. If under 30 breaths per minute, then you check for perfusion. Okay, so you can check for radial pulse. If it's absent, okay, or over 2 seconds, or capillary refill is more than 2 seconds, then you control breathing, they become red. If the radial pulse is present, mental status can follow simple commands. Delayed, if not, yes. When you're called prehospitally, you should not do a start triage. There's jump start. Jump start is for pediatrics.
Yes.
Let's see. So same concept but for kids. Jump.
definitions are very complicated. Similar concepts, able to walk, minor, yes, secondary triage. Breathing, no. Position area, breathing, yes. Immediate, apnea, power pulse, no. The deceased, if there's yes, you give 5 rescue breaths. If they're still not breathing, then they're deceased. If they're breathing, then they become immediate. Check respirates, they use 15 and 45 as cutoffs versus 30. So under 15 over 45, immediate. 15 to 45, check for pulse, no. Immediate. Then yes, level of consciousness, AVPU, appropriate posturing. P is appropriate posturing, or U. So if the P or U, you get immediate. If the A, B, or P, delayed, you don't get this part. P, appropriate posturing. If they're posturing, yeah.
With posturing.
Yeah.
Comes the
Immediate. Okay, so if they're responding there appropriately, then they're fine. Okay. All right. Good.
All right. Question 1, 3 marks. Name 3 criteria for the diagnosis of DKA. Name 3 criteria for the diagnosis of DKA. For 3 marks. Question 2, for 3 marks. Name 3 toxic ingestions that charcoal is not effective. Name 3 toxic ingestions that charcoal is not effective. 3 marks. No, serious. Question 3. What is the antidote for alcohol poisoning? What is the antidote for alcohol poisoning? 1 mark. Next. Final question, 2 marks. What device has been used to immobilize the femur below? What device has been used to immobilize the femur below? Okay. You still get 30 seconds. Alright, you have 30 seconds to finalize your answers. 30 seconds. 30 seconds to finalize your answers. Higher. Let's go. So, criteria for the diagnosis of DKA.
Hata hiyo imetoka. It does not want to be the Sasa itakuwa made the best team.
Tugawane tu ng'ombe hapa. So DKA criteria, okay? Serum ketones above 1.5 millimoles per liter, pH less than 7.3, or bicarbonate less than 18, okay? And sugars above
15.
So the answers,
Yes.
what if you've just written, without the values?
What have you written?
We wrote 2 plus for urine.
So you have urine ketones, what else have you written?
They've just written hyperglycemia.
We used 11.
Hyperglycemia.
11.
Acidosis.
My question is, if you've just written hyperglycemia without the value, like above 15 millimoles or below, it's just hyperglycemia.
So hyperglycemia.
Acidosis and ketones. It's not.
Yeah, that's correct.
It's fine.
But if you write the wrong value.
Exactly. You need hyperglycemia, you need acidosis, and you need ketones.
So it's fine.
Correct. Okay.
But just to be
Yes.
on the same page, hyperglycemia above
15, yes.
and then
pH less than 7.3 or bicarb less than 18 and serum ketones above
2.5.
What's the factor for
These are pediatrics now, yes. Ketones is above, serum ketones above 1.5, but if you don't have serum ketones, you have urine dipsticks ketones, yes. So urine dipsticks ketones are tricky because, if I should have asked that one, differential diagnosis for urine dipsticks ketones, what is it? Starvation, AKA, alcoholism, all of you give positive dipsticks. That's why you don't choose dipstick ketones. Yes. All right. Next question. Toxic ingestions that charcoal is not effective. They are failed. Is looking at mnemonic for it.
Fails.
Fails. Yes. Let's find them. Yeah. Here. Okay. So not helpful. So fails. Pesticides, petroleum distillate, unprotected airway, hydrocarbons, heavy metals. If it's more than 1 hour. Acid, alkali, alcohols, altered level of consciousness, aspiration risk, iron, ileus, intestinal obstruction, lithium, lack of a gag reflex, solvent, seizures, so fails. So all these people don't get charcoal.
For example, you've written heavy metals for iron and lithium, then you've written bleach for solvents
Alkali.
there.
Yeah, that's okay. Alright.
Haya, sasa nijue
Good, yeah. So 3 marks for that.
kama zinipatia chako.
Antidote for alcohol poisoning, ethanol.
Yes.
Ethanol. 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 Yes.
Yes, I know. Written ethanol 10% alcohol.
No, it's alcohol.
It's alcohol. It's ethanol. Yes. It's alcohol.
It's alcohol.
Yes. It's
So the
ethanol.
thing is, correct me.
This one is Oli's.
Yes.
If it is methanol, you give ethanol. If it is ethanol, you give the antidote is methanol. So
No, it's
no.
ethanol is normal alcohol. Yes. So everyone else gets ethanol.
And the
If kumikumi is methanol, give ethanol still.
So you give them what?
Everyone ethanol. Everyone gets ethanol. So if you have overdosed on ethanol, you're just superbly drunk.
Airway protection.
Yes. Airway protection. Yes. Exactly. Yes. So ethanol. Okay. What device has been used to immobilize the femur? A Sega splint. SAGAR. That's spelling.
That's what lost mark.
Sega splint. SAGAR. So let's see. Mark them out. So all of it should be out of 9. Should be out of 9. Okay. So it's 3, 3, 7, 8, 9. Should be out of 9.
Out of 9.
Yes. Out of 9. Alright, congratulations. Congratulations, great winners.
Enkishui. Yes. 9 out of 9. Good stuff. Haya. Yes. Haya. They are flash discs. They're not ATMs. They are flash discs. Yes. Good.
Everyone is a winner.
That's it.
Uliwapatia kazi ya
So bring your protocols to them or to you?
Ah!